How is lung cancer diagnosed? Your doctor may suspect lung cancer if a physical exam reveals swollen lymph nodes above your collarbone, a mass in your abdomen, weak breathing, abnormal sounds in your lungs, dullness when your chest is tapped, unequal pupils, droopy eyelids, weakness in one arm, expanded veins in your arms, chest, or neck, swelling of your face. If your calcium is higher than normal and no other cause is apparent, your doctor might suspect lung cancer. Lung cancer, which originates in the lungs, can also spread to other parts of the body, such as distant bones, the liver, adrenal glands, or the brain. It may be first discovered in a distant location, but it's still called lung cancer if there is evidence it started there. Once lung cancer begins to cause symptoms, it is usually visible on an X-ray. Occasionally, lung cancer that has not yet begun to cause symptoms is spotted on a chest X-ray taken for another purpose. Your doctor might order a CT scan of your chest for a more detailed exam. Diagnosis of lung cancer is usually confirmed with a lung biopsy. The doctor guides a thin, lighted tube through your nose or mouth and down the air passages to the tumor and removes a tiny tissue sample. This is called a bronchoscopy. This is useful for tumors near the center of the lung. If the biopsy confirms lung cancer, your doctor will use other tests to determine the type of cancer and how far it has spread. Nearby lymph nodes can be tested for cancer cells with a procedure called a mediastinoscopy, while imaging techniques such as CT scans, PET scans, bone scans, and either an MRI or a CT scan of the brain can detect cancer elsewhere in the body. If fluid is present in the area between the tissue layers lining the chest wall and lungs, removal of the fluid with a needle, called a thoracentesis, may help diagnose cancer as well as improve breathing symptoms. If the fluid tests negative for cancer cells, which occurs about 60% of the time, then your doctor may do a procedure known as a video-assisted thoracoscopic surgery, or VATS, to examine the lining of the lung for tumors and to perform a biopsy. Because saliva, mucus, and chest X-rays have not proved particularly effective in finding small tumors, annual chest X-rays for lung cancer screening are not recommended. This information provided by the Consumer Advisory.